About 80% of people in the United States have below optimal cardiovascular health, and only about 19% of US adults have high heart health. So overall, cardiovascular health in America is suboptimal. But there are new opportunities that are coming to light to improve and maintain optimal heart health across life course. So here to talk with us today is Dr. Nauman Mushtaq to let us know all about it. Thank you for joining us, Dr. Mushtaq.
Hello. Morning, Dan. I'm doing well. Thank you.
All right. What is the status of cardiovascular health in America?
Despite tremendous advances in cardiovascular medicine over the last 50 years, the truth is that cardiovascular disease still remains the number one killer of adults in the United States. Almost 700,000 people die of heart disease every year in the US. And as you mentioned, research from Northwestern Medicine's shown that 4 out of 5, 80% of US adults have suboptimal cardiovascular health. And that number is only projected to increase over the next 20, 30 years. So sobering numbers.
All right. So can lack of sleep increase your risks of severe heart problems?
So poor sleep hygiene, both duration of sleep and quality of sleep, have recently been identified through a preponderance of data to really adversely impact your cardiovascular health, including increased risk of heart attack, increased risk of stroke, poor hypertension or blood pressure control, weight gain, blood sugar control, and getting the recommended amount of sleep for your age group, which for most adults is 7 to 8 hours at least, can really improve your cardiovascular health.
So how do wearables aid in detecting cardiovascular episodes like AFib?
Yeah, so wearables are everywhere, right? So smartwatches help us monitor our heart rate, our heart rhythm, our activity levels, and our sleep hygiene. And that feedback provides us with valuable information that we can utilize to improve our healthcare. Researchers here at Northwestern Medicine are doing studies to look at smartwatches and use that to detect specific types of heart rhythm disorders like atrial fibrillation, a heart rhythm problem that affects about 5 million people, and use that information to then enable people to direct treatment for an episode of atrial fibrillation, thereby decreasing their risk of stroke, risk of bleeding, and hopefully improving cost of care.
So why is AI technology in the field of medicine growing, and how can it be beneficial to all this?
So, artificial intelligence, like in other fields, is really a game changer for medicine, and Northwestern's at the forefront of this. We're incorporating artificial intelligence in all of our programs to help improve our risk prediction, to improve our ability to diagnose disease, and then really help in precision medicine by tailoring therapies specifically for patients rather than a one-size-fits-all. So an example through our Center for Artificial Intelligence, we're really using machine learning algorithms to identify high-risk heart failure populations who will benefit from targeted advanced therapies for heart failure.
Well, thank you very much, Doctor. Where can we go for more information?
So for more information, please visit heart.nm.org.
Thank you very much.
Thank you for having me.